photography is very important as we are doing complex restorative dentistry. You know, we want to document all the different steps. It's important for lab communication. It's important in many different ways. But I'm reminded that many dentists don't use photography as frequently as they can in their practice. And I'm going to recommend that you use these 6 digital photos for patient education with every adult new patient in your practice. Every adult new patient. Now, some of you might say, well, wait a minute. What if they're 20 years old that have never had a cavity in their head? By definition, they'd be an adult. I'm going to say yes. It's so easy to take these photos, and then you can compliment the patient. You can compliment them on their home care. You can compliment them on how good of a job they do in taking care of their teeth. But more often than not, these photos are going to help the patient see their teeth in a way they've never seen before. The way they've never seen before. Naren, think about how most people, I'm talking about the public now, not us dental nerds. Us dental nerds see teeth in a very different concept than the public, right? Yes. We do. I'm talking about the public. How does the public see their teeth? Well, I'm going to suggest the predominant ways they see their teeth are a reflection in the mirror, a foamy reflection as they're brushing their teeth in the morning and the evening, or in the family vacation photos, right? You know, when you're standing in front of the giant sequoia tree and we take the picture, that's how they see, and that doesn't give them any detail at all. And so these 6 photos, it's just 6. These 6 photos will help the patient see their teeth in a way they've never seen before. And we typically hear 2 common reactions from patients of all ages. Wow, I've never seen my teeth like this before. And secondly, they usually say some variation of, yuck, what's this? What's that? As if they're discovering it for the first time. Like the patient might say, I didn't realize my lower teeth were so crowded. Like that's a new revelation to, and in some cases, I believe it actually is because they haven't seen it like this. So here are these 6 photos. By the way, I want to give credit to Dr. Frank Spear. These are his 6 photos. He taught me those, and I want to give him credit and share them with you. The first one is just a head and shoulders shot. Ask the patient to smile naturally. Just snap that photo. By the way, we're taking these with a digital camera, not an intraoral camera. We're taking them with a digital camera. So the first one is a natural head and shoulders shot. Smile for me naturally. The second one is a close-up retracted view. Have the patient hold the retractors out, and you'll move in very close because this is a close-up. In the viewfinder, we're looking for the middle of the nose, middle of the chin, middle of the cheeks, so it's very much a close-up on the smile. And we ask the patient to open their mouth a little bit, so there's about a 3/4 of an inch to an inch separation between the upper and lower teeth. That way we can see the incisal edges. Patient holds the retractors, we take the photo. The third and fourth photos we borrowed from our friends, the orthodontists. We take an upper occlusal view and a lower occlusal view using the hourglass-shaped mouth mirror. These are the hardest of the 6 to take because the tongue can get in the way, the cheeks can get in the way, the mirror can fog up. You're not actually taking a picture of the teeth. You're taking a picture of the reflection of the teeth in the mirror. So you want to take that hourglass-shaped mouth mirror. You want to put it as far back on the tongue as you can without triggering the gag reflex. And then you snap these photos. Anybody, even though these are a challenge to take, anybody can learn to take those photos very quickly. And then the 5th and 6th photos are the left buccal corridor and the right buccal corridor. Have the patient hold the retractor, point the camera 45 degrees down the buccal corridor. Those are the 6 photos. By the way, how I'd recommend that you do is you schedule a workshop, an in-service workshop with your team, doctors, where you practice taking these 6 photos of your team members.